Hello, my name is Wolfgang Miesbach from the University Hospital in Frankfurt, Germany, and it's my pleasure to report about a presentation from the EAHAD Congress that took place early this year in February in Frankfurt. It's about the first report of a long-term follow-up extension study 6 years after gene therapy with AMT-060 in adults with hemophilia B, and this report confirmed the safety and stable factor IX expression as well as sustained reductions in factor IX use. Now, the study construct was an AAV5 vector together with a wild type factor IX. And this is called AMT-060, and later on the same vector has been used together with the Padua factor IX variant to treat patients in the phase 3 trial with etranacogene dezaparvovec, and in the meantime etranacogene dezaparvovec has been approved for the treatment of hemophilia B in the US and the EU. The study design of the AMT-060 phase 1 trial included 2 dose cohorts. One dose cohort received the gene therapy at a lower dosage with 5 times 10 to 12 genomic copies per kilogram. The second dose cohort was 2 times 10 to 13 genomic copies of a kilogram. This was an open-label, single-dose, multi-center trial in adults with hemophilia B and a factor IX activity of less than 2%. And the results of the study have been presented previously. 9 out of 10 participants were prophylaxis-free after AMT-060 administration. The mean factor IX activity at 52 weeks in cohort 1 was 4.4%, and in cohort 2, 6.9% at week 26. AMT-060 had a favorable safety profile, and the dose of cohort 2 was chosen for further clinical development and start of the phase 3 trial. And now we report the first year of follow-up in the extension study representing 6 years after AMT-060 administration. Now, the patient characteristics differed between cohort 1 and cohort 2. Now, the factor IX activity at year 6 of follow-up was in cohort 1 4.6%, in cohort 2 5.8%. So this was a steady factor IX expression up to 6 years after treatment, sustaining bleed protection in participants from cohort 2. So all participants from cohort 2 were free from joint bleeds from year 5 onward, and all participants from cohort 2 were also free from spontaneous bleeds from year 4 onward. This was also associated with a sustained reduction of factor IX use over 6 years post-treatment. In the cohort 1, there was 1 participant who remained on factor IX prophylaxis, and 4 participants remained free of factor IX prophylaxis. And all of these 4 participants of cohort 1 also remained free of prophylaxis over 6 years post-treatment. In cohort 2, the higher dosed cohort, all participants remained free of factor IX prophylaxis and also up to 6 years post-treatment, and What is also important, no participant in this cohort had an on-demand factor IX injection during year 6. Most important, no new safety events were identified during year 6, and the safety profile remained favorable. So it could be concluded from this gene therapies for hemophilia A and B, including etranacogene and dexaparvovec, were recently authorized in Europe and the US. Durability of factor expression is a key consideration in the decision-making process for patients and physicians. Phase 1-2 extension study, where the data have been presented, will follow patients through 15 years post-AMT-060 administration for long-term efficacy, for example, joint health and quality of life, and also safety assessments. And this 6-year follow-up after AMT-060 administration confirms the safety, durability, and stability of factor IX expression after AAV-based gene therapy reported previously. And with this, I would like to thank all the study participants, the investigative site teams, and the sponsor study team members, as well as you. Thank you very much for your attention.